Good evening and welcome to this year's annual members meeting. My name is Kamran Malik. I am the Interim Chair at the Rotherham NHS Foundation Trust. I'd like to take a few minutes to introduce today's meeting. You may have seen that Martin Havanan has recently stepped down as Chair after 9 years of service to take a new role at the Yorkshire Ambulance Service. I would like to take this opportunity to thank Martin for his dedication and leadership over the years and wish him all the very best in his new position as Chair at YAS. Dr. Michael Richmond has been appointed as the new Chair and will join the Trust early next year. Until Michael's arrival, I will be acting as Chair before returning to my role as Vice Chair. This hasn't been the only change to our board this year. I'm delighted that in September 2022, Dr. Richard Jenkins became our substantive Chief Executive alongside his role at Barnsley Hospital NHS Foundation Trust. Sally Kilgariff was appointed as Chief Operating Officer in May 2022 and Dr. Joe Beahan joined the Trust in December 2022 as our new Medical Director. I would like to thank Mrs. Susan Douglas, who stepped in as Interim Medical Director until Dr. Beahan arrived. Daniel Hartley joined the Trust as Director of People in June 2023. So this evening is our opportunity to reflect on the previous financial year. It's important to us that we share with you, the people of Rotherham, along with our colleagues, members, governors and partners, our achievements and challenges. Tonight we will hear from Dr. Richard Jenkins, our Chief Executive, who will give an overview of how the Trust is performing and a look ahead to the future. Helen Dobson, our Chief Nurse, and Dr. Joe Beahan, our Medical Director, will discuss how we provide safe and effective care for our patients. This will be followed by Sally Kilgariff, our Chief Operating Officer, who will take us through the Trust performance against some key national metrics. Next, our Director of Finance, Steve Hackett, will update us on our financial performance during 2022-23, and our external auditors will describe the findings of the annual audit and the Trust's financial statements. Daniel Hartley, our Director of People, will discuss caring for our staff, including the results of the National Staff Survey. Michael Wright, Deputy Chief Executive, will talk us through how we utilise partnership working. We will also hear from our lead governor, Gavin, who will provide an update from our Council of Governors. There is an opportunity for you to submit questions using the Q&A button on your screen. We will answer your questions and any which have been submitted in advance during the live element of this evening's meeting. The last financial year has certainly presented challenges, including a prosecution by the Care Quality Commission in relation to historical safeguarding matters going back a number of years. The Trust accepted that the systems and processes at the time were not sufficiently robust, but lessons have been learned and practices changed. I would like to say thank you to everyone here at the Trust for all their hard work. Staff have continued to show tremendous dedication and resilience during the year as we continue to be challenged by the ongoing implications of COVID-19. The Trust also had to transition very quickly from dealing with the pandemic to dealing with the increase in acute activity and demand. I'm pleased to report, however, that there are also many things for which we can be proud. The Trust has for a number of years had conditions placed on our registration by the CQC, and I'm delighted that for the first time in several years, the Trust is now operating without any sanctions. We have continued to collaborate as a key partner in the South Yorkshire Integrated Care System, the South Yorkshire and Bassett Law Acute Federation, and the Rotherham Place. Rotherham Hospital and Community Charity has seen the support from the community increase substantially thanks to the introduction of some fabulous events, including skydives, firewalks, and corporate sponsorship from local businesses. None of this could have been achieved without the dedication and passion of our hard-working teams throughout the community and hospital services. I hope you will join me in once again thanking them. I'd now like to hand over to Richard Jenkins.
Good evening. I'm Dr. Richard Jenkins, Chief Executive of the Rotherham NHS Foundation Trust. The 2022-23 year was a challenging one across the NHS as we continue to feel the impact of COVID-19, as well as an increased prevalence of flu and dealing with industrial action. Despite the challenges, we made significant progress in reducing long waits for planned care, cancer and diagnostic tests. We achieved the national requirements in planned care and ensured no patient waited more than 78 weeks by year end. However, waiting times in our urgent and emergency care centre are still too long, and we've been working very hard to address this. Work is continuing to improve patient waits in A&E, as well as improve our patient flow through the hospital and into the community. The Trust was prosecuted by the CQC in relation to historical safeguarding cases. The team and I have reflected that whilst we felt there were robust safeguarding processes in place now, and these have received positive feedback following independent external scrutiny, at the time of the incidents in 2019-20, we agreed they were not. We are now held up as an exemplar trust to other organisations who need support with their processes. The Trust has been operating under a range of CQC sanctions since 2015, and I'm delighted to say that through the hard work and dedication of our staff, these have all been removed in recent months. Our progressive investment in quality improvement initiatives is critical to ensure we have a culture of continuous improvement in the Trust. We have put significant emphasis on improving our patients' experience while in our care, and as part of this work, we've implemented a number of initiatives. These include, but are not limited to, changing our visiting times, signing up for John's campaign, becoming a veteran-aware accredited organisation, the Sleep Helps Healing campaign, and increasing the focus on nutrition and hydration on our wards. Staff engagement continues to be a very high priority, and I'm pleased to say that our staff survey results have improved year on year. The overall response rate of 61% was the highest ever response rate for our Trust, and the Trust is also scoring higher than average on all the people promise elements. We now have one of the very best staff surveys in the Yorkshire region. We will continue to strive to improve our results further. I'd like to express my deep thanks and gratitude to all our staff who have worked extremely hard over the last year, as we've adapted to new ways of working so that we can continue to provide safe and effective care for all our patients.
Hello, my name is Helen Dobson. I'm the Chief Nurse at the Rotherham NHS Foundation Trust. This past financial year, we have continued to change and adapt to new ways of working in order to provide safe and effective care for our patients. Patient safety and high quality care remain our top priorities, and we continue to focus strongly on improving patient experience. We have listened to patient feedback and implemented a number of quality improvement projects in response. In April 2022, we introduced standardised visiting times on all adult inpatient wards. We have also pledged to support John's campaign, meaning we welcome carers at all times to support patients living with dementia or experiencing delirium, including overnight if necessary. You may have seen our Sleep Helps Healing banners and posters throughout the hospital. This campaign aims to reduce the noise on wards at night to promote a peaceful environment for patients to rest and recover. We have also introduced initiatives to support and promote nutrition and hydration for inpatients, including a traffic light system for water jugs to make monitoring liquid intake easier on wards, and the introduction of Making Mealtimes Matter. This has also been supported by our inpatient tea parties, which we hold each quarter. These tea parties encourage wards to be creative in their promotion of social dining and are often linked to national events such as the Queen's Jubilee and Armistice Day. In August 2022, over 90 welcome boards were added to wards and clinical areas in Rotherham Hospital. These boards are bespoke to each area and provide patients and visitors with lots of useful information at a glance. These are supported by the bedside patient information folders, which are available in multiple languages and digitally via our website. I'm delighted that our work to support our veterans, both patients and staff, was recognised last year as we became Veteran Aware accredited. We have worked together with clinical areas to develop communication stations, which include resources to help colleagues connect with patients with varying communication needs. We will continue to respond to patient feedback and have further quality improvement projects ongoing. Back in March 2022, the CQC placed conditions on our licence relating to the Urgent and Emergency Care Centre. Since then, UECC have implemented a number of initiatives to make improvements to services. The CQC were kept up to date with the progress of these improvements, and now, for the first time in 8 years, I'm delighted to say that all conditions have been lifted from our licence. The lifting of these conditions shows how far we have come on our journey to outstanding. We will continue to build upon this, both within UECC and across the whole organisation, with the aim of improving our overall CQC rating at the next inspection. The impact of the COVID-19 pandemic was less acute for most of 2022 to 2023. However, an increase in cases of flu during winter, combined with the challenges of COVID-19, both from a patient and a staff absence perspective, led to an increased period of sustained operational pressures. I am proud of the operational, medical and nursing teams, all of whom coped admirably, continuing to work tirelessly to balance the need of a continued response to COVID-19 with the need to deliver wider healthcare services to the population. District nursing provided support and care for patients in need within the restrictions placed on everyone as a result of the pandemic. The team ensured patients in need were seen as soon and safely as practicable, and in a number of areas have continued to implement new ways of working. We know that most patients recover more quickly when they receive the care they need within their own homes. That is why this year we have introduced a number of admission avoidance and discharge supporting initiatives, including discharge to assess and virtual ward. We will continue to develop these and work with partners to ensure that they are utilised effectively. Our colleagues are our greatest asset, and that is why we work hard to ensure they feel valued and proud to work at the Rotherham NHS Foundation Trust. Retention has been a big focus for us this year, and we've had huge success with our work to retain our valued nursing, midwifery and healthcare support workers. There has been a sustained reduction for people in these staff groups leaving the organisation since November 2022, and there are a wide range of initiatives that have supported this. This has been acknowledged externally, and the Trust is recognised as a positive role model in this respect. Going forward, we hope to replicate this success with other staff groups. Although we are here to discuss the last financial year, it would be remiss of me not to mention the recent crimes that have taken place at the Countess of Chester Hospital. We have all felt the impact of this shocking and upsetting case. I would like to reassure our members and the general public, as well as our staff, that we have many systems in place to support colleagues to raise concerns, not least through our Freedom to Speak Up Guardians. We actively encourage staff members to raise concerns through any of the channels they feel comfortable with. We are determined to be an organisation that listens. Finally, I would like to thank colleagues for their continued dedication to our patients and to our journey of improvement. I'm incredibly proud of everything we've achieved so far and believe we can look forward to a bright future.
Good evening, I'm Dr. Jo Beahan, Medical Director here at the Trust. I'd like to speak a little bit about mortality and safety at the Rotherham NHS Foundation Trust. Following the significant focus on mortality performance during 2021 to 22 and the delivery of hospital standardised mortality rates within the as expected range in the final month of reporting for the year, this successful achievement has been retained for every month. Similarly, the summary hospital level mortality indicator has remained within the as expected range, with diagnosis specific alerts continuing to reduce. However, we are aware that this requires focus and investment to continue. The mortality analytic groups have continued to identify key actions required around themes and trends, and to drive improvements around the 3 C's: quality of care, case mix and coding. In addition, going forward, we will see increased levels of medical workforce input and ownership into the mortality review process. Patient safety is a vital part of our work. As a trust, we have a positive instant reporting culture, as seen through the number of low and no harm incidents reported through the formal instant reporting route. Work has been ongoing throughout the last financial year to strengthen our learning from incidents and how we share this learning throughout the organisation. Planning has commenced for the implementation of the new Patient Safety Instant Response Framework, known as PSIRF, which is a system-based approach to learning from patient safety incidents. Thank you to my colleagues who strive to keep patient safety at the heart of everything they do.
Good evening. I'm Sally Kilgariff, Chief Operating Officer. As we continue our recovery from the COVID-19 pandemic, we are focusing our efforts on reducing long waits for planned care as well as cancer and diagnostic tests. This is a challenge facing the NHS as a whole, and although I'm pleased to say that we are making significant progress, we know we still have a long way to go. We have seen our waiting list grow across the majority of specialties as referrals return to pre-COVID levels. Whilst we undertook additional activity to reduce waiting times, we also experienced some significant workforce challenges, meaning at times we were unable to run our full theatre timetable. Given the pressures on emergency care, our elective activity was also reduced during the busiest periods in order to support the capacity required for emergency admissions. Our focus this year will be on ensuring we continue to recover and reduce the length of time patients are waiting for their treatment through both additional activity and working as efficiently as we can. Last year, we continued to pilot new emergency care standards, and as such, we don't report against the 4-hour A&E target. However, in March, the government confirmed that they would not be progressing with the new standards and set the NHS a target of seeing 76% of patients within 4 hours by March 2024. This year, we are therefore reintroducing the 4-hour standard in our urgent and emergency care centre. Successful delivery of this will require significant changes to our ways of working, and we have begun a comprehensive programme of work to ensure we can meet this target. In partnership with the Rotherham Place system, we developed a winter plan to ensure we could meet the expected demand on our services. This resulted in additional acute and community capacity being brought on stream from the autumn. This was our first winter in many years where we were able to continue running our elective orthopaedic service throughout the winter months due to the innovative reconfiguration of our ward areas. Our community services continue to see increased activity across adult and children's services. This reflects the ongoing drive to provide care closer to home and away from the acute hospital setting. Our community teams were at the forefront of a number of significant innovations, including the development and implementation of new virtual ward model, discharge to assess pathways, and the expansion of our care coordination centre into a transfer of care hub. In addition, this was the first year of the urgent and community response standard, with our team successfully achieving this 2-hour standard throughout the year. Despite challenges, we were able to meet the national ask to eliminate all patients waiting over 78 weeks by the end of the year. Our referral to treatment performance was the top quartile across all acute and community providers in the country, showing how effectively our teams have managed the challenges they have faced. We also reduced the number of patients waiting over 62 days on a cancer pathway to below the trajectory set at the start of the year, with just over 40 such patients at the end of March 2023. We didn't achieve the constitutional 62-day standard throughout the year due to some of the pressures already discussed. We've focused on embedding and improving the new faster diagnosis standard, with the standard of 75% achieved in March 2023. As part of this, we recruited a small cancer improvement team who reviewed pathways to identify delays and implement new processes to remove these. The National Constitutional Standard for Diagnostics requires that no more than 1% of patients should wait longer than 6 weeks for diagnostic tests, which were delivered consistently before the pandemic. A national target has now been set to achieve no more than 5% of patients waiting by March 2025. We have continued to benchmark very well against this, and we're performing in the top 10 of all acute or combined trusts at the end of the last financial year, with less than 4% of patients waiting over 6 weeks. Finally, I would like to take this opportunity to thank our hard-working colleagues whose efforts have seen us make significant progress this year. Although we still have further work to do, I'm really proud of our teams and their dedication to improving services for patients.
Hello, my name is Steve Hackett and I'm the Director of Finance here at Rotherham NHS Foundation Trust. The 22-23 financial year was challenging for all the NHS, whilst dealing with the effects of COVID-19 and moving into a recovery phase. I'd like to thank finance colleagues and divisional colleagues for all the hard work that they've done throughout the year to produce financial plans that ensured we used our resources effectively, whilst continuing to provide sustainable patient care. We finished the financial year ahead of plan with a £1.5 million deficit against a £2.6 million deficit plan. The organisation continued to see pressures in high-cost agency spend and the impact of high inflation on non-pay items. However, our cost improvement programme delivered ahead of plan, saving £9.2 million for the organisation. Whilst managing the day-to-day pressures in the organisation, our managers still continued to ensure that we spent our resources on capital well. Collectively, we invested £14 million on improving our estate, IT infrastructure, as well as investing in medical equipment to provide high-quality, sustainable patient care. Some great examples are the refurbishment of Keppel Ward at £2 million, Community Diagnostic Centre £1.5 million investment, electrical infrastructure at £1 million, and £4 million on medical equipment, including CT scanners, gamma camera and other essential items. The financial year ended with a cash balance of just over £24 million, which again is good. However, going forward, 23-24 financial year will continue to be challenging. We will collectively work together with our partners to ensure that we use our resources wisely to provide sustainable services for the people of Rotherham. Thank you for listening.
Hello, my name is Daniel Hartley and I've recently joined the Trust as Director of People. We understand that caring for colleagues is vital to the success of our organisation. That is why it's important that we listen to our staff and we understand how we can best support them. Each year, the NHS issues a national staff survey and I'm delighted to say that we recorded our highest ever response rate this year. 61% of colleagues took the time to complete the survey compared to a national average of 44%. The survey results help us to understand how we can make the Rotherham NHS Foundation Trust a better place to work and receive care. It provides a high-level overview linked to the 7 areas of the NHS People Promise, as well as categories for morale and staff engagement. Our results from the staff survey have improved year on year, and we now have some of the best survey results in Yorkshire. This year, we scored higher than average in all 7 areas of the People Promise, along with morale. We saw a lower performance in the staff engagement category, in particular the questions around advocacy, and we've since undertaken work to improve this. Although it is great to see positives from the survey, we'll continue to work to improve the experience of all our staff. Colleagues are encouraged to complete the national quarterly pulse surveys, which give staff a more regular opportunity to share their views about working here at the Trust. We use the results of the staff survey and the quarterly pulse surveys along with other information such as CQC feedback to develop improvement plans to make the Rotherham Foundation Trust a great place to work. We've invested in many refurbishments for wards and clinical areas. We've made improvements to staff rooms, kitchen facilities and changing areas. As our people are our greatest asset, it's essential that we continue to support the health and well-being of all our colleagues, many of whom have experienced very, very difficult and traumatic working conditions over the last few years. The engagement and wellbeing team work with colleagues across the Trust to deliver a range of programmes of support. This has included confidential counselling sessions, menopause cafes, health MOTs, weight management support, access to fitness sessions, talking groups and workshops. During the year, our network of wellbeing champions has grown to include and emphasise the impact that the menopause can have on colleagues. I'm delighted to see our staff networks, BAME, Disability, LGBTQ+, continue to grow and flourish. These networks are run by staff and are supported by our Trust Board. They're doing great work to provide peer support and contribute to improvements across the Trust in terms of policy and practice. As part of our work to support staff, we have an All About Me passport. This helps to facilitate a person-centred approach to management of colleagues, including reasonable adjustments. During the financial year, the Trust has also piloted a workplace disability advisor role to better support disabled colleagues, students and job applicants. Alongside the Workforce Race Equality Standard and Disability Equality Standards, we have piloted the Equality Delivery System 2022. This assists us in discussions with local partners, including the people of Rotherham, to review and improve services, as well as improve the experience of employment for people with characteristics protected by the Equality Act 2010. Despite the challenges placed on the organisation by the pandemic and subsequent recovery, we know that valuing and celebrating the achievements of our staff is essential to enable the future growth and development of the organisation. That is why, in July 2022, we celebrated Proud Week. This involved a recognition of all the learning taken place by our colleagues and those who have earned qualifications throughout the year. This was followed by our Proud Awards ceremony held at Magna, which recognised both individuals and teams who were nominated and shortlisted for their excellence in delivering or supporting others to provide fantastic care to our patients. The evening was also a chance to recognise colleagues long service with a special presentation for those who had reached the incredible milestone of 40 years service. Of course, this has also been a year of noticeable disruption for the NHS as a whole. A number of trusts across the country were impacted by the industrial action taken by the Royal College of Nursing from December 2022. Nursing colleagues at the Rotherham NHS Foundation Trust did not take part in strike action as the vote did not meet the required thresholds. However, I was pleased to see that a resolution was reached between the Royal College of Nursing and the government. Industrial action has been taken by junior doctors and consultants for a number of months now and is ongoing. We recognise that this situation is difficult for our doctors who are striking and for those who are not. Everybody wants to protect patient safety and care, so we have empathy for the decisions of everyone involved. We want to see a resolution as soon as possible to the strikes, but ultimately pay is a matter for the government and the trade unions. I would like to thank staff for continuing to provide patients with the best possible care under these difficult circumstances and for their ongoing dedication to the Trust and the people of Rotherham. Thank you.
Hello, I'm Michael Wright, Deputy Chief Executive at the Rotherham NHS Foundation Trust. Over recent years, the direction of the NHS has changed from that of individual organisations to a much more collaborative approach. The Rotherham NHS Foundation Trust has had partnership arrangements in place for some services, such as the Barnsley and Rotherham Integrated Laboratory Services, BRILS, for a number of years. We've established a formal strategic partnership between ourselves and Barnsley Hospital NHS Foundation Trust to enable a number of collaborative work streams to take effect. We have continued to identify areas that would benefit from such arrangements and recently launched a joint gastroenterology service. This development will provide a resilient and sustainable service to the people in both areas. In addition, we continue to have a joint ear, nose and throat on-call rota with Doncaster and Bassetlaw Teaching Hospitals NHS Foundation Trust, covering emergency access across the region. NHS South Yorkshire Integrated Care Board became a statutory body on the 1st of July 2022, with a focus on how organisations in the region can work together. We continue to be a core member of the South Yorkshire and Bassetlaw Acute Federation and provide a collaborative of the 5 acute trusts in South Yorkshire. The Trust has also continued its close working relationships with our partners across Rotherham, including Rotherham Metropolitan Borough Council, Rotherham, Doncaster and Southampton NHS Foundation Trust, and primary care and the voluntary sector. Our integrated discharge team, running collaboration with Rotherham Council, has become further established, to ensuring that we have been able to support the discharges of our patients in a timely manner. We are committed to tackling health inequalities, and our commitment to close partnership working will support the reduction of disparities between outcomes for our communities. It is clear that the future of NHS services relies on strong and productive partnerships. I look forward to seeing how we can develop our services to provide the best healthcare to the people of Rotherham while maintaining resilience and sustainability.
Hello everyone, thanks for having me here today. My name's Daniel Watson and I'm a director with Mazars and the Trust's external auditor. I've been asked to come and summarise our work on the Trust's 22-23 financial statements audit. Our work covers two main areas. Firstly, that's our work on the Trust's financial statements, and secondly, it's our work on the Trust's arrangements to deliver value for money. So I'll just cover both of those quickly in turn. Firstly, on the financial statements, the Trust provided draft accounts and supporting working papers in advance of the national deadline. These were of very good quality. Our audit focused on 4 key risk areas: management's ability to override controls, improper recognition of revenue and expenditure, the valuation of the Trust's land and building assets, and a new accounting standard for leasing. There were no significant matters raised on any of these audit risk areas. These are all standard risks that you'd find across most trusts in the country, so there's nothing to be concerned about in terms of us raising those risks in the first place. We issued an unqualified opinion on the 29th of June, which confirms that the accounts show a true and fair view of the Trust's financial position. We did identify a small number of control issues and one unadjusted misstatement in terms of lease assets, but again, nothing to be concerned about in terms of the overall result. Having an unqualified opinion is a really good position for the Trust to be in. Secondly, just to cover briefly our work on Trust value for money arrangements, we look at the arrangements in 3 key areas. Firstly, financial sustainability. That's how the Trust sets and manages its budget to deliver its outcomes for the year. Secondly, we look at governance, how the Trust manages its risks and how it makes properly informed decisions. And finally, we look at improving economy, efficiency and effectiveness. And that's how the Trust uses performance information to manage its services. Given the challenging financial environment all trusts operating in today's environment, we focused in particular on how the Trust delivered its cost improvement plans in 22-23. We didn't identify any significant weaknesses in the Trust's arrangements, but we did identify one other recommendation, relating to the trust control, the cost improvement programme for 23-24, just setting out really that the trust needs to continue focusing on that because it is still a difficult financial environment going forwards. I'd like to place on record our thanks to the trust, in particular the finance team, who were really helpful throughout the audit. The audit isn't an easy process and it's quite challenging for the trust finance team to deal with, but they dealt with it really well and were able to answer all our questions promptly. And as I say, the accounts were a really high standard. I'd just like to say thank you again and happy to take any questions.
Hello and good evening. As League Governor, it is once again my privilege to briefly respond on behalf of the Council of Governors to the annual report for 2022-23. The NHS and the Trust continue to face challenges going forward, as you've already heard. And this last year has also seen the NHS bed in the new arrangements from clinical commissioning groups to integrated care boards, or ICBs. These changes will continue to have a big impact on how and where the people of Rotherham receive their care in the future. The Council of Governors believe that the appointment of Dr. Richard Jenkins as our substantive joint CEO with Barnsley was an important piece in cementing Rotherham's place within our new ICB. Under his stewardship and with the support of our executive and non-executive colleagues, we believe that the Trust will continue on its upward trajectory and continue to meet the long-term goals laid out in the 5-year plan. The Governors know that the most important asset of the Rotherham Foundation Trust are our colleagues, and so staff health and wellbeing and morale are key to driving our continual improvement. The recent staff survey results from 2022 showed a marked improvement in that regard, although there are still areas that need to be addressed. It is an area that the Governors continue to take an interest in and monitor. In my response to the report last year, I mentioned that the Care Quality Commission visited in 2021 with mixed results, and the enforcement conditions along with the overall status of requires improvement were disappointing. I also mentioned that the Chief Nurse and colleagues were working tirelessly to improve our position and remove sanctions. In 2022, the Trust once again welcomed the Care Quality Commission, who carried out inspections at the Trust. The Governors were concerned that enforcement conditions were taking against the Trust during the previous year and that more conditions were applied in 2022. The Governors are very pleased that because of the work done across the Trust, led by our Chief Nurse, all of the conditions that were put in place have now been lifted and there are no sanctions against the Trust. And we are hopeful that the Trust can meet its aim to be an outstanding Trust in the very near future. The Council of Governors interviewed and appointed 2 new substantive non-executive directors in Dee Sissons and Martin Temple. I also want to take the opportunity to thank 2 outgoing non-executive directors, Lynn Haggett and Michael Smith, for their time and efforts whilst working at the Trust. I mentioned last year that public governors have a very important role in representing the voice and the diversity of the local community, and in also influencing the continual improvement of health services for the people of Rotherham. Last year we held mid-term elections and we managed to elect 4 new public governors and 2 new staff governors. If you are a member of the public or of the Trust and are interested in improving the health and well-being of the people of Rotherham, then please do consider standing in the next elections. In summary, I wanted to say that the Council of Governors want to take this opportunity to again thank and pay tribute to everyone who works for the Rotherham Foundation Trust and all of the other NHS staff in Rotherham for their dedication, diligence and hard work. Without their commitment, their passion and their willingness to go above and beyond, the NHS in Rotherham and beyond would simply not be able to function and help the millions of people that it does. Their compassion and their resilience are something to be commended. Thank you and good evening.
The work we have done over the last few years has made some significant improvements for both patients and staff, but we know there is still a lot of work to do. Following a year of more normal operations, we now need to concentrate on returning to pre-pandemic delivery and performance of our elective and non-elective services. We recognise the impact that extended waiting times have had on our communities, and we are determined to continue our improvements throughout 23-24. One of our key areas for focus in 23-24 is to ensure we are effectively engaging with our medical workforce as we look to deliver our ambitions. The last few years have been very challenging for many of our colleagues, both within work environments and outside of them, and there is a greater need than ever before to ensure our medical workforce are helping to drive our organisation forward as we continue to find ways to work through these difficult periods. After a number of years trialling new emergency performance standards in our urgent and emergency care centre, we have transitioned back to the national 4-hour standard. This involves revisiting our processes and procedures across the whole trust. The programme of work we have designed will continue to focus on how we manage flow through the organisation in order to deliver on the national expectation of achieving 76% by March 2024. As well as ensuring appropriate and timely access to care for patients attending the trust via our urgent emergency care centre, it is critical that our recovery of elective activity continues, especially now the majority of constraints from operating through enhanced infection prevention and control measures have been removed. All trusts have been given ambitious activity targets to deliver, with our organisation needing to rapidly see a step change in our activity levels if we are to achieve these. Notably, our waiting list has continued to grow over the last year, whereas in order to ensure successful delivery of future national long wait ambitions in 2023-24 and 24-25 in particular, we will need to see this trend reverse. As we continue on our journey of improvement, I am grateful to my colleagues across the whole trust for their perseverance and dedication.
So for the next item on the agenda is the approval of the minutes for last year's annual members meeting. So I'd like to seek approval for the meeting that was held on the 20th of September 2022. Am I okay to approve? I'm not seeing any objections, so approved. Thank you. Following that, there were no actions, so that's a nil return. The next section is the Q&A section that we have, which allows both pre-submitted questions and live questions. There were no pre-submitted questions, but there was one live question. So I'd like to introduce Richard Jenkins, Chief Executive, and Gavin Rimmer, the Lead Governor. So this question I will position to Richard. The question is, staff, do they have the option of a COVID vaccination for this year? And if so, will it be compulsory?
Thank you, Chair. So nationally, there is going to be a COVID vaccination programme starting more or less now for frontline NHS workers. So that is being rolled out in this trust, but it is whilst it's something we would strongly encourage people to have, it is up to the individual member staff whether they are prepared to have that. So it's not mandatory. We'll be running that in parallel with the annual flu vaccination campaign, which again is ongoing now. And we do strongly encourage staff to have both vaccinations, but it is entirely up to the members of staff whether they do so or not.
Thank you, Richard. Very clear answer. There are no other questions. So that was the only question submitted, which Richard has answered. So that leads me to close the meeting. So in closing this annual members meeting, I'd like to once again give both mine and everyone's deep thanks and appreciation to all our colleagues in the provision of service to patients in what can be very challenging times. So deep felt thanks to everyone. Thank you, and that formally closes this meeting.